When Hurricane Helene hit North Carolina earlier this year, it left a wake of destruction. One place which was damaged was Baxter's North Cove, North Carolina location. Baxter is a huge healthcare corporation, and their North Carolina facility produces 60% of the intravenous solutions used in the United States. It also makes fluids utilized by patients on dialysis and sterile water used to clean patient surgery sites during operations. When Hurricane Helene struck the North Cove area, the storm washed out nearby bridges and water entered the factory, which forced the North Cove facility to shut down. According to Baxter, there was no structural damage to the site. Employees at Baxter's North Carolina location have returned to work doing a deep cleaning of the facility. Additionally, a lot of equipment needs to be repaired. Baxter hopes it will resume production of its intravenous fluids by the end of the year. In the meantime, the intravenous fluid shortage is creating havoc across the United States. Medical facilities are severely rationing their intravenous fluid supplies. Non-emergency surgeries have been canceled. Hospitals and emergency departments have been hit especially hard. Approximately 50% of patients going to the emergency department and hospital are not able to receive the necessary intravenous fluids they require. Many patients are being told to drink Gatorade. However, for people who are severely nauseous or who cannot drink by mouth, this has been detrimental. Patients are suffering severe dehydration from not being able to receive intravenous fluids. Moreover, people who are experiencing sepsis, a life-threatening condition, which is often treated by being given copious amounts of intravenous fluids, are not being given all the fluids they require. Sepsis is a very serious medical condition which has a high mortality rate. Add in the patient's inability to receive the proper amount of intravenous fluids, the likelihood the patient will pass away increases. For me, the IV shortages have caused several changes to my care. My medical team has told me if I become sick, I should avoid going to the emergency department. I have been informed the emergency department will not be able to give me intravenous fluids or my IV nutrition called TPN. I have been advised to stay home unless I'm at imminent risk of dying. And if I do go to the emergency department, I should bring along my own intravenous fluids. Second, I use intravenous dextrose in water to help combat my blood sugar from dropping too low. At the moment, I'm no longer able to get these bags of dextrose with water from my infusion company. In the meantime, if my blood sugar does drop, I should drink juice and hope and pray my blood sugar increases enough to prevent me from suffering serious health consequences. Next, I received a letter from my infusion company informing me the multivitamins I use in my IV nutrition are being rationed. Instead of adding multivitamins to my bag of IV nutrition every day, I am now only to add multivitamins 3 days a week. Additionally, I have been informed my intravenous nutrition called TPN is at risk of being discontinued. Some of the fluids which are used to create the IV nutrition are in extremely short supply. For the moment, I will continue to receive my intravenous nutrition. However, in the weeks to come, I may not be able to receive all my bags of IV nutrition. I have been told if this happens, I will just have to adjust to only receiving intravenous nutrition every other day of the week. Lastly, all my elective procedures have been canceled. Thankfully, I do not need emergency surgery and I am not in severe pain. However, all my medical care, which requires me to go to the hospital, has been postponed for the indefinite future. I am slightly annoyed this incident has happened because it is history repeating itself. In 2017, Hurricane Maria struck Puerto Rico and severely damaged Baxter's Puerto Rico plant, which produces intravenous saline. The havoc it created on the U.S. healthcare system was astronomical, and now it has happened again. I hope now that 2 hurricanes, which have caused severe intravenous fluid shortages in just 7 years, will prompt the industry to diversify manufacturing and will allow more companies in many different locations across the United States to create intravenous fluids. Thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to share and comment. It really helps my channel. I hope you have a great day and a wonderful week. Bye-bye!